Hello and welcome to Uncharted, the patient masterclass to understand your cancer and improve your outcome. My name is Dr. Christopher Gregg. I am a scientist and a cancer patient. This talk is an introduction to how our understanding of cancer has radically changed recently. And it's changed in many ways that doctors are not aware of. Our new understanding of cancer has emerged from crosstalk from many different fields. This new crosstalk is coming from scientists interacting between the fields of evolutionary biology, ecology, immunology, big data, nutritional science, and of course, oncology. And together, these scientists are starting to learn new information that can potentially completely transform how we treat cancer and how we think of cancer. So our understanding of cancer has really fundamentally changed. And we're going to talk about that. We're going to learn about that in this course. And one of the things that I think is so important is that we're really in a position to now empower patients to radically and quickly improve their care. But the path to getting that done and to making that really happen it's critical that we give patients the right knowledge and the right tools. And quite frankly, we need to give the researchers and the doctors in many cases the right knowledge and the right tools. And this was a huge motivation for me to build this course. As a scientist who works across many different fields, I could see all of this new knowledge emerging, but I could also see that it was not being disseminated very effectively to patients or to other people in the field. Our understanding of cancer has changed in a lot of very fundamental ways recently. In the past, or in many cases presently, we think of cancer as a disease that is caused by gene mutations that cause cells to grow uncontrollably in our body. But there is a very different picture that's emerging from this crosstalk between different fields, and that is that cancer is an evolutionary process. A tumor can have tens of billions of different cells in it, and those cells are different, they're dynamic, they're changing constantly, and they're competing with each other. And interestingly, we can even start to think of cancer as a sort of speciation event, which is a bit of scientific jargon that means that essentially these cells have grown into something that's very different from the patient that they live in and that they came from. Understanding cancer as an evolutionary process is very, very helpful because it reveals new rules and approaches that can potentially control cancer, and it gives us a much clearer understanding of how we might eliminate cancer from our bodies. In the old world perspective, the best way to treat cancer is to think of all cancers simply more or less as cells that are growing uncontrollably and that they should be killed or at least have their growth inhibited by a drug. But in this new world, every cancer and patient is different. The cancer is a moving target, and tumors contain so many cells that are different and evolving and competing with each other. They spread, they look for new niches in the body where they can grow. They're behaving just like species in evolution that are undergoing natural selection. They're looking for resources that they can live off of, and they're constantly evolving and changing, and some are dying out and some are succeeding. These are all different rules and these offer different rules and different perspectives for treating and understanding cancer. It has some big implications. In the old world, advanced cancer patients all receive what's called the maximum tolerable chemotherapy dose. And the idea is to give the maximum tolerable dose to maximize killing of the cancer and try to either control the cancer or even get rid of the cancer, which in advanced cancer patients is very difficult. But in the new world, treatments, we recognize now that treatments need to be delivered precisely and at specific times that control the evolutionary processes that the disease is undergoing. And that these can be done in a way that optimizes disease control and the quality of life of the patient. Instead of giving all patients essentially the same maximal tolerable doses of chemotherapy drugs, we're learning that what we need to build, because cancers and patients are different, we need to build personalized care pathways or programs that combine drugs in a smart way and incorporate nutritional programs and mental and behavioral health care support, all in a way that is an effective program that gives that patient the best chance for a good outcome or the best outcome that they can get and a very high quality of life. This is the new world and the new goal that we're working towards, and this course is going to unpack how we get there quickly. Fundamentally, the way cancer care is delivered right now is it's reactive medicine. Patients appear in the clinic and they're very sick, and the doctors are working to figure out what the problem is and then fix that problem. They're reacting to the problem. And that happens for cancer patients on therapies as well. Their drug may progress. Their drug treatments, they progress on their drug treatments, which means that the drugs are no longer working and the cancer has evolved resistance. And now the doctor is in a position where they need to make decisions to react to that and come up with a new treatment program. What we want to do is switch from reactive medicine to predictive medicine, where doctors have access to tools where they can actually predict what is likely to happen in the future for the patient and make decisions that help to delay or avoid bad things from happening. And so we switch from predictive medicine, where we take proactive measures to prevent bad things from happening rather than trying to fix them after they've happened. So for this new changes that are happening in cancer care, there are a number of major shifts. In the old world of cancer care, new discoveries were very slow. This hypothesis-driven research that we're going to learn more about is expensive. It's difficult to put studies together, and they're often yield conflicting results, which can be very, very confusing. And the whole research enterprise, honestly, is very slow in terms of making discoveries and translating those for patients. In the old world, stage 4 cancer, which is the stage of cancer that I have, is a terminal diagnosis. And patients are treated with what's called palliative care, which means the oncologist's mission is to maximize the amount of time that you have left and the quality of life. But in the new world, with this new understanding and some of the new tools that are available, big data enables new discoveries to be made at massive scale to quickly reveal patterns for how to improve outcomes for specific subtypes of patients. We can learn rapidly when we work together and share information. There are new ways and ideas for how to treat cancer based on evolutionary principles. One of these is called adaptive therapy, which offers the potential of turning advanced cancer, which is a terminal diagnosis, into a chronic and manageable disease where you essentially live with your cancer, but it doesn't cause overt symptoms, and it doesn't cause you any harm, and you take the drugs in a very smart way that just keeps the cancer under control and keeps it from evolving and spreading and causing harm. The crosstalk between ecology and evolution and the oncology field has also revealed new ideas that we've learned from how species go extinct in nature. And this has taught us how we can potentially cure stage 4 cancers using old drugs in a smart new way. As cancer patients, we frankly don't have time for the 10 or 15 or 20 years it takes for clever new drugs to be developed. We need to understand how to use the drugs that we have today in a smarter way. And we're going to talk a lot about that in this course. One of the things that patients are surprised about when I talk to them about some of the topics in this course is that they learn, they're surprised to learn that they are in fact the most important element of the cancer research and discovery engine. In many cases, it may feel like the doctor holds all of the knowledge and makes all of the care decisions, and that the scientists hold all of the control over what problems are addressed and how research dollars are spent. But what is increasingly true is that the patients have profound control over the system, over what clinical trials are run successfully, over what treatments they want themselves and they want to be created, and what problems can and should be solved. The objective of this course is to train what I call master patients. Master patients are patients that have the right knowledge and access to the right tools and opportunities to fundamentally and very quickly change cancer care, to improve outcomes for themselves, for their friends, and to create a new system that radically transforms how we treat cancer, using principles that allow us to do things just in a much smarter way, rather than creating entirely new technologies or new drugs. And I think that what's fundamental to this process of master patients coming together is generosity and sharing of information. It is the right understanding. I recognize that wading through the cancer literature and all of the confusing books on Amazon about different diets and different approaches to take control of cancer and your cancer care is very, very confusing. It's very, very frustrating. We're going to have a lecture about some of the many frustrations in the world and why they exist and how to solve them. And master patients are empowered to put forward the right effort. So they're working on the right problems, using the right tools, the right opportunities to improve their care and the care for others. So they're not spinning their wheels and wasting time. And together with those three things, generosity and sharing, right understanding, and right effort, I believe that we can launch some incredible leaps that will become clearer and very well-defined in this introductory module of the course. My personal goal is that master patients will come together to transform cancer care in under 3 years. This is absolutely achievable. And the plan will be very clearly unpacked, and the science and the knowledge will be unpacked in this class. Thanks for listening.